The fluorescent lights of St. Catherine's Medical Center cast their usual harsh glow across the surgical floor as Dr. Michael Chun adjusted his white coat for the third time that morning. At 26, he carried himself with the careful precision of someone who knew that every gesture, every decision, every word would be scrutinized by colleagues who believed he didn't belong. "There goes our boy Wonder," whispered Dr. Patricia Wells, a senior resident, as Michael passed by the nurse's station. Her voice carried just enough volume to ensure he heard every word. "Wonder how long before his inexperience catches up with him." Michael's jaw tightened imperceptibly, but he continued walking. 6 months had passed since his appointment as chief resident, and the whispers hadn't diminished. If anything, they had grown louder, more persistent, like a constant background noise that threatened to drown out his confidence. The appointment had been controversial from the start. Dr. Michael Chun had graduated at the top of his medical school class, completed his residency with perfect evaluations, and demonstrated surgical skills that surpassed many doctors with twice his experience. But none of that seemed to matter to his colleagues, who saw only his age and their own missed opportunities. Dr. James Morton, the head of surgery, had defended the decision during the heated department meeting 6 months earlier. "Merit isn't determined by age," he had said, his voice cutting through the protests of senior staff. "Dr. Chun has earned this position through exceptional performance, not through connections or politics." But earning the title and earning respect were two entirely different battles. As Michael entered the pre-op briefing room that Tuesday morning, the conversation among the surgical team died to an uncomfortable silence. Dr. Sarah Martinez, the attending cardiac surgeon, looked up from the patient charts with an expression that barely concealed her skepticism. "Good morning, Dr. Chun," she said, her tone professionally courteous but emotionally cold. "I trust you've reviewed the Peterson case?" Michael nodded, pulling the thick file from under his arm. 12-year-old female, diagnosed with a rare cardiac tumor. Preliminary scans suggest it's wrapped around the left atrial wall with possible extension into the pulmonary veins. "And your assessment?" Dr. Martinez asked, though her question sounded more like a test than a genuine inquiry for his medical opinion. "Complex but operable," Michael replied without hesitation. "The tumor's position is challenging, but with careful dissection and possible hypothermic circulatory arrest, we can achieve complete resection." Dr. Wells exchanged a glance with another resident. "Hypothermic circulatory arrest on a 12-year-old? That's an extremely aggressive approach for someone so inexperienced." The word hung in the air like an accusation. Michael felt the familiar weight of doubt pressing down on his shoulders, but he maintained his composure. "The alternative is allowing a malignant tumor to continue growing around her heart. Emma Peterson has maybe 6 weeks without intervention." Dr. Martinez closed the chart with a decisive snap. "The procedure will be challenging enough without unnecessary risks. We'll proceed with standard resection techniques. Dr. Chun, you'll assist, but I'll be making all critical decisions." Michael wanted to argue, to present the research he'd done, the case studies he'd reviewed, the innovative approaches that could give Emma a better chance at complete recovery. But he was 26 years old in a room full of doctors who saw his youth as a disqualification rather than an asset. "Understood," he said simply. The briefing concluded with assignments and preparations, but Michael noticed how the other staff members avoided making eye contact with him. He had become accustomed to this isolation, this sense of being an outsider in a profession he had dedicated his life to mastering. After the meeting, Dr. Morton approached him in the hallway. The older man's face showed the weariness of someone who had spent decades navigating hospital politics and medical egos. "You're handling this well," Dr. Morton said quietly. "Better than I did at your age. Did you face the same resistance?" Michael asked, though he suspected he already knew the answer. Dr. Morton smiled grimly. "I was 32 when I became chief resident. Even then, they called me too young. But you, Michael, you're facing something different. You're not just young, you're exceptional. And that threatens people in ways they don't even understand." The words were meant to be encouraging, but they only reinforced Michael's sense of being trapped between his capabilities and others' perceptions. He had the knowledge, the skills, and the dedication to excel in his role, but he was constantly fighting a battle against preconceived notions about what a leader should look like. As he walked toward the surgical prep area, Michael reflected on the path that had brought him to this moment. Medical school had been demanding but straightforward. Success was measured by test scores and clinical performance. Residency had been exhausting but rewarding. He could see his skills developing with each case, each procedure, each patient interaction. But leadership was different. Leadership required not just medical expertise but the ability to inspire confidence in others, to make difficult decisions under pressure, and to bear responsibility for outcomes that affected human lives. At 26, he had the first qualification but was constantly fighting to prove the others. The Peterson case weighed heavily on his mind as he reviewed the surgical plan one more time. Emma Peterson was a bright 12-year-old girl who loved soccer and dreamed of becoming a veterinarian. Her parents had traveled from 3 states away after local doctors declared her tumor inoperable. She deserved the best possible care, not a surgery limited by politics and personal grudges. Michael pulled up the imaging studies on his computer, studying the tumor's position and characteristics for what felt like the 100th time. The mass was indeed complex, but he could see opportunities that the standard approach would miss. The tumor had grown in a specific pattern that suggested it could be removed with minimal damage to surrounding tissue if the surgical team was willing to use more advanced techniques. But being right and being heard were two different things, especially when you were 26 years old in a room full of skeptics. As he prepared for surgery, Michael made a decision that would define not just his career but his understanding of what it meant to be a leader. He would assist as requested, but he would also be prepared for the moment when assistance became leadership, when someone had to make the difficult decisions that others were afraid to make. He didn't know that moment would come sooner than anyone expected. The operating room at St. Catherine's Medical Center had witnessed thousands of procedures over the decades, but few carried the weight of expectation that surrounded Emma Peterson's surgery. The 12-year-old lay unconscious on the table, her chest prepped and draped, while the surgical team made final preparations around her. Dr. Sarah Martinez stood at the head of the table, her reputation as one of the region's finest cardiac surgeons preceding her into every operation. She had performed hundreds of tumor resections, saved countless lives, and earned the respect of colleagues throughout the medical community. But even she felt the pressure of this particular case. "Scalpel," she said, her voice steady and professional. The initial incision was flawless, revealing the layers of tissue that protected Emma's heart with the precision that had made Dr. Martinez's reputation. Michael stood across from her, his role clearly defined as assistant, but his eyes were already analyzing what they revealed. "Excellent visualization," Dr. Martinez commented as they opened the chest cavity. "The tumor appears to be exactly where the imaging suggested." But as they gained access to the heart itself, the complexity of Emma's condition became apparent. The tumor wasn't simply attached to the cardiac wall as the scans had suggested. It had grown in intricate tendrils that wrapped around vital structures, creating a web of malignant tissue that pulsed with each heartbeat. "This is more complex than anticipated," Dr. Martinez murmured, her confidence wavering slightly as she assessed the situation. Michael leaned forward, his trained eye taking in details that the initial imaging had missed. The tumor's growth pattern was unusual but not unprecedented. He had seen similar cases in the medical literature, procedures performed at major cardiac centers with specialized techniques that weren't commonly used at regional hospitals. "Dr. Martinez," he said quietly, "the tumor's attachment points suggest we might need to consider temporary cardiac arrest to achieve complete resection." Dr. Martinez's response was sharp and immediate. "Dr. Chun, I appreciate your input, but this is my operation. We'll proceed with standard resection techniques." The exchange was overheard by the other members of the surgical team, and Michael felt the familiar weight of being dismissed despite his medical reasoning. He stepped back slightly, but his eyes remained focused on the surgical field, watching as Dr. Martinez began the delicate process of tumor removal. The first 30 minutes of the procedure went according to plan. Dr. Martinez worked with the skill and precision that had earned her reputation, carefully dissecting tumor tissue from healthy cardiac muscle. But as she reached the more complex areas where the malignancy had wrapped around critical structures, the limitations of the standard approach became apparent. "I can't get adequate visualization," she admitted, frustration creeping into her voice. The tumor extends further than the imaging suggested. Michael watched as she struggled with a section of tumor that had grown around a major coronary artery. The standard approach required working around vital structures, but the tumor's position made this nearly impossible without risking damage to the heart's blood supply. "Dr. Martinez," he said carefully, "if we could achieve temporary cardiac arrest, we could rotate the heart and gain access to the posterior attachments." "I said we're not using cardiac arrest," she replied firmly, but Michael could hear the uncertainty in her voice. The tension in the operating room grew palpable as Dr. Martinez continued to struggle with the tumor resection. Each attempt to gain better access resulted in more bleeding, more complications, and less confidence from the surgical team. Dr. Wells, serving as the second assistant, glanced nervously at the monitors showing Emma's vital signs. The 12-year-old's heart was showing signs of stress from the prolonged manipulation, and her blood pressure was beginning to fluctuate. "Her vitals are becoming unstable," Dr. Wells reported, her voice carrying a note of concern that reflected the growing anxiety in the room. Dr. Martinez paused, her hands trembling almost imperceptibly as she assessed the situation. She had removed perhaps 60% of the tumor, but the remaining tissue was in the most critical locations, wrapped around structures that couldn't be damaged without devastating consequences. "We may need to consider a two-stage procedure," she said, though the words sounded more like an admission of defeat than a medical decision. Michael felt a surge of frustration that he struggled to contain. A two-stage procedure would mean closing Emma up with malignant tissue still growing around her heart, allowing the tumor additional time to progress while they planned a second surgery weeks later. For an aggressive cancer in a 12-year-old, those weeks could make the difference between cure and terminal diagnosis. "Dr. Martinez," he said, his voice respectful but insistent. "With respect, a two-stage approach gives the tumor time to progress. If we could reconsider the cardiac arrest protocol." "Dr. Chan." Dr. Martinez's voice cut through the operating room like a surgical blade. "I am the attending physician on this case. Your job is to assist, not to second-guess my medical decisions." The rebuke was delivered with the full authority of her position and experience, but Michael could see something in her eyes that contradicted her confident words. She was struggling, and she knew it. The tumor was more complex than she had anticipated, and the standard approach was failing. But she was also trapped by the same dynamics that had made Michael's appointment as chief resident so controversial. Admitting that a 26-year-old resident might be right would undermine her authority in front of the surgical team and acknowledge that experience wasn't always the determining factor in medical judgment. The operation continued for another 20 minutes, with Dr. Martinez making incremental progress but failing to achieve the complete resection that Emma needed. The 12-year-old's vital signs continued to show signs of cardiac stress, and the atmosphere in the operating room grew increasingly tense. It was during this critical moment, as Dr. Martinez struggled with a particularly challenging section of tumor, that the unexpected happened. The attending surgeon, who had been leaning over the patient for nearly 2 hours, suddenly straightened up and took a step backward. "I need," she began, but the words were cut short as she collapsed. Dr. Martinez hit the floor with a sound that echoed through the suddenly silent operating room. The woman who had been leading the most critical surgery of Emma Peterson's life was unconscious, leaving a 12-year-old girl with her chest open and a partially resected tumor around her heart. For a moment that seemed to stretch into eternity, nobody moved. The surgical team stood frozen, staring at their fallen colleague and the critical patient who needed immediate attention. That's when Michael stepped forward. Truth, the operating room had transformed in an instant from a place of controlled medical precision to a scene of crisis and confusion. Dr. Sarah Martinez lay unconscious on the floor, while Emma Peterson remained on the table with her chest open and her heart exposed. A partially removed tumor still wrapped around vital cardiac structures. "Get Dr. Martinez to the ER immediately," Michael ordered, his voice cutting through the shocked silence with an authority that surprised even him. "Call for Dr. Morrison and any available cardiac surgeon." But even as he issued the commands, Michael knew that time was working against them. Emma's heart had already been under stress for over 2 hours, and the partial tumor resection had left her in a precarious state. Waiting for another surgeon to arrive, assess the situation, and take over the procedure could mean the difference between life and death for the 12-year-old girl. Dr. Wells stared at him with wide eyes. "Michael, you can't possibly be thinking of—" "Dr. Wells," he interrupted, his gaze fixed on Emma's vital signs, which were showing increasing signs of cardiac distress. "How long before Dr. Morrison can get here?" "At least 20 minutes, she replied, understanding immediately the implications of his question. 20 minutes was too long. Emma's heart was showing irregular rhythms, her blood pressure was dropping, and the partial tumor resection had created bleeding that needed immediate attention. In 20 minutes, they might be trying to resuscitate a 12-year-old girl instead of saving her life. Michael moved to the head of the operating table, taking the position that Dr. Martinez had occupied moments earlier. His hands were steady, his mind clear, despite the enormity of what he was about to attempt. "I need everyone to focus," he said, his voice calm but commanding. "Emma needs us to work as a team right now. Dr. Wells, I need you to monitor her cardiac rhythm closely. Any changes, any irregularities, I need to know immediately." Dr. Wells nodded, though uncertainty flickered across her face. She had questioned Michael's appointment as chief resident, had whispered about his inexperience and youth, but now she found herself depending on his leadership in the most critical moment imaginable. Michael examined the surgical field, taking in the work that Dr. Martinez had completed and the challenges that remained. The tumor was more complex than anyone had anticipated, but he could see patterns and possibilities that the standard approach had missed. "We're going to need cardiac arrest," he announced, his decision made with the clarity that comes from medical knowledge overriding political considerations. "Michael," Dr. Wells said, her voice filled with concern, "you're talking about stopping a 12-year-old's heart. If something goes wrong, if we don't stop her heart, we can't remove the tumor completely," he replied. "And incomplete resection means the cancer comes back. Emma deserves better than that." He looked around the operating room at the team members who were now looking to him for leadership. These were the same people who had questioned his qualifications, who had whispered about his age and inexperience. Now they were waiting for him to make decisions that would determine whether a 12-year-old girl lived or died. "I know what you're all thinking," Michael said, his voice steady and confident. "You're thinking I'm too young, too inexperienced, too ambitious. But right now, Emma needs a surgeon, not a committee. And I'm the surgeon who's here." The words carried a weight that transcended age and politics. In that moment, Michael wasn't a 26-year-old resident trying to prove himself. He was a doctor with the knowledge and skills necessary to save a life. "Prepare for hypothermic cardiac arrest," he ordered. "We're going to stop her heart, rotate it, and remove every bit of this tumor." The next few minutes were a carefully choreographed dance of medical precision. The surgical team worked with Michael to prepare Emma for the most complex part of the procedure, the part that Dr. Martinez had been reluctant to attempt at as Emma's heart slowed and then stopped. The operating room became a place of intense focus and collaboration. Michael worked with hands that moved like they had performed this procedure hundreds of times, though in reality, he had only observed it during his training at specialized cardiac centers. "Rotating the heart now," he announced, gently lifting and positioning Emma's heart to expose the tumor attachments that had been inaccessible through standard approaches. What he saw confirmed his earlier assessment. The tumor had grown in a pattern that made complete resection possible, but only through techniques that required stopping the heart and working in the brief window that cardiac arrest provided. "Incredible visualization," Dr. Wells murmured, watching as Michael began the delicate process of removing tumor tissue from areas that would have been impossible to reach through conventional surgery. Michael worked with a precision that seemed to transcend his years of experience. Each cut was deliberate, each decision based on a deep understanding of cardiac anatomy and tumor behavior that he had acquired through relentless study and observation. "How much time do we have?" he asked, though he was already monitoring the clock that determined how long Emma's heart could remain stopped without causing permanent damage. 12 minutes remaining in the safe window," replied the perfusionist managing the heart-lung bypass machine. 12 minutes to remove the remaining tumor tissue and restore Emma's circulation. Michael felt the familiar surge of adrenaline that came with high-stakes surgery, but his hands remained steady, his mind focused on the task at hand as he worked, removing the final strands of malignant tissue from around Emma's coronary arteries. Michael realized that something had shifted in the operating room. The whispers and sideways glances had been replaced by focused attention and genuine collaboration. The surgical team was working with him, not merely following his orders out of obligation. "Last section of tumor removed," he announced, holding up a piece of tissue that had been wrapped around Emma's left coronary artery. "Complete resection achieved." The words carried profound satisfaction, but Michael knew the most critical moment was yet to come. Removing the tumor was only half the challenge. Now he had to restart Emma's heart and ensure that she could survive the trauma of the extensive surgery. "Preparing for cardiac restoration," he said. "Everyone needs to be ready for potential complications." As the heart-lung bypass machine began the process of rewarming Emma's blood and preparing to restore her circulation, Michael felt the weight of responsibility that came with leadership. He had made decisions that would determine the course of a 12-year-old girl's life, and now he had to live with the consequences. But as Emma's heart began to beat again, showing strong, regular rhythms on the monitors, Michael felt something he hadn't experienced since becoming chief resident: the satisfaction of earning respect through competence rather than title. Respect. The rhythmic beeping of Emma Peterson's heart monitor filled the operating room as her vital signs stabilized, each steady pulse a testament to the successful completion of one of the most complex cardiac tumor resections the hospital had ever witnessed. Michael stepped back from the table, his surgical gloves stained with the evidence of 2.5 hours of intensive work, but his expression showed the quiet satisfaction of a job well done. "Her rhythm is strong and regular," Dr. Wells reported, her voice carrying a note of amazement that she couldn't quite suppress. "Blood pressure is normalizing, and all cardiac indicators are within normal parameters." Michael nodded, but his attention remained focused on the monitors that told Emma's story in numbers and waveforms. The 12-year-old had endured hypothermic cardiac arrest, complete tumor resection, and surgical techniques that pushed the boundaries of what was typically attempted at a regional medical center. "Dr. Chun," said Janet Morrison, the head surgical nurse, her voice filled with respect that hadn't been there hours earlier. "I've been working cardiac surgery for 15 years, and I've never seen tumor resection performed with that level of precision." The compliment carried weight beyond its words. Janet had worked with dozens of cardiac surgeons, had assisted in hundreds of procedures, and had seen the best and worst that the operating room had to offer. Her respect was earned through competence, not granted through politics or position. As the surgical team began the process of closing Emma's chest, Michael found himself reflecting on the transformation that had occurred over the past few hours. The same colleagues who had questioned his appointment as chief resident were now working with a level of cooperation and respect that he had been seeking since the day he accepted the position. "The suture work is beautiful," Dr. Wells observed as Michael carefully closed the layers of tissue that protected Emma's heart. "Where did you learn that technique?" "Dr. Yamamoto at Boston Children's Hospital," Michael replied, his hands working with the steady rhythm of someone who had practiced each movement countless times. "I spent 2 weeks observing his procedures during my elective rotation." It was a small detail, but it revealed something important about Michael's approach to medicine. While his colleagues had seen his youth as a limitation, he had used it as an opportunity to learn from the best surgeons in the country, absorbing techniques and approaches that weren't commonly used at regional hospitals. Dr. Morrison entered the operating room just as Michael was placing the final sutures. The head of surgery surveyed the scene with the practiced eye of someone who had spent decades evaluating surgical outcomes. "How's our patient?" he asked, though Emma's stable vital signs had already provided the answer. "Complete tumor resection achieved," Michael reported. "No complications during cardiac arrest, and her heart function appears to be completely normal." Dr. Morrison approached the table, examining Michael's surgical work with careful attention to detail. The incision was perfectly aligned, the sutures were placed with textbook precision, and Emma's vital signs indicated that she had tolerated the complex procedure remarkably well. "And Dr. Martinez?" Dr. Morrison inquired. "Exhaustion and dehydration," Dr. Wells replied. "She's recovering in the ER. Should be fine in a few hours." Dr. Morrison nodded, but his attention remained focused on the patient and the evidence of surgical excellence that surrounded her. As someone who had performed thousands of cardiac procedures, He recognized exceptional work when he saw it. "Dr. Chan," he said finally, "walk me through what happened after Dr. Martinez collapsed." Michael provided a detailed account of his decision-making process, the surgical techniques he had employed, and the reasoning behind each critical choice. He spoke with the confidence of someone who had considered every option and made decisions based on medical evidence rather than personal preferences. "You chose to proceed with hypothermic cardiac arrest on a 12-year-old patient," Dr. Morrison observed. "That's an aggressive approach for someone with your level of experience." The words could have been interpreted as criticism, but Michael heard something different in Dr. Morrison's tone. This was the voice of a mentor assessing the performance of a student, not a superior questioning a subordinate's judgment. "The tumor's position made complete resection impossible through standard approaches," Michael explained. "Emma deserved the best possible outcome, not the safest possible procedure." The distinction was important, reflecting a surgical philosophy that prioritized patient outcomes over surgeon convenience. It was the kind of thinking that separated good doctors from exceptional ones. Dr. Morrison smiled, the first genuine expression of approval that Michael had received from a senior colleague since his appointment as chief resident. "That's exactly the right answer," he said. As Emma was transferred to the cardiac intensive care unit, word of the successful surgery began to spread throughout the hospital. The story of the 26-year-old chief resident who had stepped in during a medical crisis and performed a flawless tumor resection captured the attention of staff members who had previously questioned his qualifications. Dr. Patricia Wells, who had been among Michael's harshest critics, found herself reevaluating her assumptions as she reviewed the surgical notes and postoperative results. The procedure that Michael had performed represented surgical skill that she had only seen from the most experienced cardiac surgeons. "I owe you an apology," she said, approaching Michael as he completed his postoperative documentation. "I was wrong about your capabilities." Michael looked up from his charts, seeing genuine remorse in her expression. "You weren't wrong to have concerns," he replied. "Leadership has to be earned, not just appointed." The conversation marked a turning point in Michael's relationship with his colleagues. The surgery had provided tangible evidence of his capabilities, but his response to criticism showed the maturity and professionalism that leadership required. Over the next few hours, as Emma's condition continued to stabilize, Michael found himself receiving congratulations and respect from staff members throughout the hospital. The successful outcome had transformed perception of his appointment from controversial decision to inspired choice. But the most meaningful recognition came from an unexpected source. Emma's parents, who had traveled hundreds of miles seeking treatment for their daughter, requested a meeting with the surgical team that had saved her life. "Dr. Chen," said Emma's father, his voice thick with emotion, "we don't know how to thank you. When we brought Emma here, 3 other hospitals had told us there was nothing they could do." Michael felt the weight of those words, understanding that his decisions in the operating room had changed the trajectory of not just Emma's life, but her entire family's future. This 12-year-old girl would now have the opportunity to grow up, to pursue her dreams, to experience all the possibilities that had been threatened by the tumor around her heart. "Emma did the hard part," Michael replied, deflecting the praise with characteristic humility. "She's a brave kid with a strong heart." But Emma's mother wasn't satisfied with modesty. "The nurses told us what happened," she said. "They told us that you took over when the other doctor collapsed, that you made decisions that saved Emma's life." Michael nodded, accepting the recognition while maintaining his focus on the medical aspects of Emma's care. "She'll need follow-up appointments and monitoring, but the tumor has been completely removed. The prognosis is excellent." As Emma's parents expressed their gratitude, Michael realized that something fundamental had changed in his understanding of leadership. It wasn't about proving himself to skeptical colleagues or earning recognition from senior staff. It was about making decisions that served his patient's best interests, regardless of personal consequences. The successful surgery had earned him respect, but more importantly, it had taught him that true leadership meant being willing to act when action was required, even when others doubted his capabilities. 3 months after Emma Peterson's surgery, the cardiac wing of St. Catherine's Medical Center had transformed into one of the region's most respected programs. The success of Emma's case had attracted attention from medical centers across the country, and referrals were pouring in from physicians who had heard about the innovative techniques being used by the hospital's young chief resident, Dr. Michael Chun stood in the conference room, presenting Emma's case to a group of visiting cardiac surgeons from major medical centers. The presentation had become a regular request, as doctors sought to understand the decision-making process and surgical techniques that had made such a complex procedure successful. The key factor, Michael explained, pointing to the imaging studies displayed on the conference room screen, was recognizing that the tumor's growth pattern made standard resection approaches inadequate. Complete removal required techniques that provided better visualization and access. Dr. Elizabeth Harrison from Johns Hopkins Medical Center raised her hand. Dr. Chun, the hypothermic cardiac arrest protocol you used isn't standard practice for most regional hospitals. How did you develop confidence in that approach? Michael smiled, remembering the months of study and observation that had prepared him for that critical moment. During my training, I made it a priority to learn from specialists at major cardiac centers. The technique itself wasn't new, but applying it to the specific tumor configuration required adapting established protocols to Emma's unique presentation. The question revealed something important about Michael's approach to medicine. While his colleagues had initially seen his youth as a limitation, he had used his position as chief resident to continuously expand his knowledge and capabilities. He attended conferences, observed procedures at specialized centers, and studied the latest research with the intensity of someone who understood that patient outcomes depended on surgeon preparation. After the presentation, Dr. Harrison approached Michael privately. "We've been following your work," she said. "Johns Hopkins is looking for someone to head our pediatric cardiac surgery program. Would you be interested in discussing the opportunity?" The offer represented everything Michael had worked toward: a position at one of the nation's premier medical centers, resources that would allow him to push the boundaries of cardiac surgery, and recognition from the medical community's most respected institutions. But Michael's response surprised Dr. Harrison. "I'm honored by the offer," he said, "but I'm committed to building something special here at St. Catherine's. We're proving that exceptional cardiac care doesn't require being in a major metropolitan area." His decision to remain at St. Catherine's reflected a maturity that went beyond surgical skill. Michael had learned that leadership wasn't about climbing professional ladders or seeking prestige positions. It was about making commitments and following through on them, even when more attractive opportunities presented themselves. Emma Peterson's recovery had been remarkable. The 12-year-old was back in school, playing soccer, and dreaming about her future as a veterinarian. Her latest scans showed no evidence of tumor recurrence, and her cardiac function was completely normal. She had become a symbol of what was possible when surgical skill was combined with courage and innovative thinking. But Emma's case was no longer unique at St. Catherine's. Under Michael's leadership, the cardiac program had begun attempting procedures that were previously referred to major medical centers. Success bred success, and the team's confidence grew with each positive outcome. Dr. Patricia Wells, who had once been Michael's harshest critic, had become one of his strongest supporters and most effective collaborators. The transformation in their professional relationship illustrated how respect, once earned, could create partnerships that enhanced patient care. "Michael," she said during their weekly case review, "we've got another complex tumor case coming in next week. 18-year-old with a mediastinal mass that's compressing his heart." Michael nodded, already thinking through the surgical approaches that might be required. "Let's schedule a multidisciplinary conference. I want input from oncology, radiology, and anesthesia before we make any treatment decisions." The collaborative approach had become a hallmark of the cardiac program under Michael's leadership. He had learned that the best surgical outcomes resulted from combining multiple perspectives and expertise areas, not from surgeon ego or individual heroics. Dr. Morton, the head of surgery, had watched Michael's transformation from controversial appointment to respected leader with pride and satisfaction. The decision to promote a 26-year-old to chief resident had been criticized and questioned, but the results spoke for themselves. "Michael," he said during their monthly review meeting, "I want you to know that your appointment as chief resident was one of the best decisions I've made in 30 years of medicine." The words carried weight beyond professional praise. Dr. Morton had risked his own reputation by promoting someone whose qualifications were questioned by colleagues and whose age made him a target for criticism. But he had seen something in Michael that others had missed: the combination of surgical skill, innovative thinking, and leadership potential that couldn't be taught in medical school. "Thank you, Dr. Morton," Michael replied. "But the real credit belongs to the entire cardiac team. Individual talent doesn't save lives. Teamwork does." His response illustrated how much Michael had grown as a leader. The young man who had once felt isolated and defensive about his appointment had evolved into someone who understood that sustainable success required building others up rather than proving personal superiority. The transformation hadn't been easy. Michael had faced months of skepticism, whispered criticism, and professional isolation. He had doubted himself during late-night calls and complex cases where experience seemed more valuable than innovation. But each successful outcome had built confidence, not just in his own abilities but in his approach to medicine and leadership. Emma Peterson returned for her 6-month follow-up appointment on a bright spring morning, her parents carrying flowers for the nursing staff and a handwritten thank you card for Dr. Chen. She looked like any other 12-year-old, energetic, optimistic, and completely unaware of how remarkable her recovery had been. "Dr. Chen," she called out when she saw Michael in the clinic hallway. "Guess what? I made the travel soccer team." Michael smiled, remembering the pale, frightened girl who had been wheeled into the operating room 6 months earlier. The transformation was complete, from a child facing a potentially terminal diagnosis to a healthy young athlete with unlimited possibilities. "That's wonderful, Emma," he said. "Your heart is strong enough for anything you want to do." As Emma and her parents continued down the hallway, Michael reflected on the journey that had brought him to this moment. He was still 26 years old, still the youngest chief resident in the hospital's history, but age had become irrelevant in the face of results and relationships built on mutual respect. The whispers had stopped. The skeptical glances had been replaced by collaborative conversations. The isolation had transformed into integration as a respected member of the medical community. But most importantly, Michael had learned that true leadership wasn't about proving others wrong. It was about consistently making decisions that served his patients' best interests, regardless of personal consequences or professional politics. Emma Peterson's case had been the catalyst, but it was Michael's response to that opportunity that had defined his transformation from controversial appointment to respected leader. He had shown that age was less important than ability, that innovation could coexist with tradition, and that sometimes the best person for a leadership role was the one whose youth allowed them to see possibilities that experience might dismiss. Epilogue. The continuing impact. 5 years after Emma Peterson's surgery, Dr. Michael Chen stood before a packed auditorium at the International Conference on Pediatric Cardiac Surgery, presenting the long-term outcomes of the innovative techniques that had originated from that critical night at St. Catherine's Medical Center. The presentation represented more than just medical research. It was evidence of how a single moment of courage and